Hey guys, this is Dr. David Midoff, physical therapist at Paso Manual Physical Therapy. I'm going to talk to you all about knee pain today. There's lots of structures in the knee that could be generating your pain. Let me rattle off a few. The patella, the femur, the patellar cartilage, the femoral cartilage, the meniscus, the hamstring, the nerves, the patellar tendon, the quads, the hamstrings, the calf muscles. You could even have pain radiating from your back into your knee. It could even be coming up from your foot as well. And how could I forget? I almost forgot the ACL, the LCL, MCL, the PCL, all those big ligaments that you hear about the athletes tearing. Many people don't realize you have three major joints in the knee. You have the patellofemoral joint, the tibiofemoral joint, and the proximal tibiofibular joint. The reason why I go into so much detail is because there's so many structures in the knee that could be causing pain, and it's hard to find out exactly which one it is. I get so many people asking me, what stretch should I do, or can you just do something real fast to my knee and make it feel better? It takes me about 30 minutes to go through all that stuff and narrow it down to the one or two things that might be really causing your pain. And it's not going to be the same solution for everybody. If it's a ligament, you got a lack of stability, so we got to talk about bracing. If there's some sort of muscle imbalance, we got to find the weak muscle and strengthen it and teach you how to move that better. If the cartilage in the knee or the meniscus is involved, then we got to talk about offloading you, and you need to be doing certain exercises to make that heal. If it's a problem from the nerves, then we got to go back up to the spine and see what's going on there that could be causing pain down in your knee. But what you could expect from us is that we will find exactly what is bothering you, how to fix it, and give you the time frame for when you should expect to be over this problem. Our ultimate goal is for you to avoid surgery, get off pain medications, and get back to doing what you love, whether it's playing sports or hanging out with family. One of the most common motions that we look at in the knee is how it's bending side to side. Don't be too worried about the knee going past the toes whenever you squat or bend. So what I'm talking about here is if you're talking about a squat, I'm looking at how the knees are moving this way. I need them to go straight over the toes, ideally. One of the most common problems we see with knee injuries is people are moving their knees inwards too much whenever they're doing squats or jumps or anything like that. Something that's commonly talked about as being a problem is the knees passing the toes whenever you're doing a squat. I don't think that's a big issue, actually. And the reason is it's not a big deal is because how else would you ever squat to the ground to pick up something from the floor or tie your shoelace? You got to be able to do that motion well. Again, it's more of a problem if you bend your knees sideways, because the knees are not designed to bend like that. They are designed to bend forward over your toes though. And in some cases, squatting like that where your knee passes your toes can be painful, but that is not likely because of that motion. It's likely because some tissues are irritated already. So whether you're an athlete and you're doing squats or you're a runner and you're running, you got to watch your knee form. If you're not into exercise, you still need to pay attention to how you're getting in and out of cars, in and out of chairs, or just getting around areas in your house as well. Make sure that your knees are tracking well. They should be generally going over your toes. Thanks for tuning in, guys. This is Dr. David from El Paso Manual Physical Therapy. Have a great day.